that is, some may not. Bell's palsy is an entrapment of a nerve, a cranial nerve, that causes drooping of the face, can cause severe pain, sharp pain into the jaw, into the face. You can't even use your muscles. Your whole side of your face kind of droops down. It's very uncomfortable and very unsettling. Some people feel like they're having a stroke. It's important to know what to do when that happens and to get the right care. And a lot of times people go to neurologists, and you went to the neurologist, right? Or what did you go to, your internist?
Went to the emergency room.
Okay.
That's the first thing you do.
Okay, and what did they do for you there?
And they say it's not a stroke, it goes away. They don't tell you about the pain.
Yeah, and as far as it going away, yes, it could go away. Sometimes it's triggered by stress. There can be some other things that trigger it as well, but there's really no treatment for it. They just kind of send you home, or sometimes they'll give you medication for it, and most often it doesn't work, and sometimes it will go away, and sometimes it takes months. So we're about...
It's going to take 3 weeks on Monday.
On Monday, 3 weeks? Okay, so we're 3 weeks in with her. You should have seen her 3 weeks ago, but she probably didn't want to be on camera 3 weeks ago, did you? You know, it's unsettling. Your whole face droops and it feels very strange, and it's even hard to talk. You can bite your tongue. You know, it's hard to chew food, so again, we're 3 weeks in, and tell everybody, you know, how you're doing.
Well, I feel a lot more mobility here with my mouth. I can close my eye, but I don't blink.
Okay.
So it's still not blinking, but I can close it. Before I couldn't close it all the way, so I had to tape it at night.
Close it. Okay. Okay.
And yeah, this part looks a lot better. So.
Okay. So, and she can smile a little bit better. That right side comes up a little bit now. So it's definitely improving. I'd say we're about, why don't you tell everybody, 50, 60, 70% improvement?
50, 60%.
Okay.
And the pain, the second week I think is the worst with the intense pain.
Mm-hmm.
And I felt pain in the roots of my teeth, like you need a root canal. I felt like someone was sticking a knitting needle in my ear.
Yeah, and you even went to a dentist.
I went to 2 dentists just to check it out because it was so bad. Yeah.
Yeah, so we're doing a mixture of things with her. We're doing upper cervical specific work, which is upper cervical adjusting to release some of the pressure on the cranial nerves. We're also, more importantly, using cold laser therapy. And the cold laser just speeds this process up 10-20 fold. And we're targeting a lot of the cranial nerves, the trigeminal nerve, the facial nerve, as well as the occipital nerves, and that's why she's doing so much better. We just finished doing Pontinen's principle on her neck and going through across some of the nerve along the facial nerve, and we're going to show you here just a couple spots that we do.
Should I put these back?
Because this whole process, yes, please.
Okay.
So this whole process is, you know, it takes about 15 minutes. We're not going to bore you all with 15 minutes of laser treatments, but we want to make sure she's wearing glasses and your eye is closed underneath there.
Mm-hmm.
Okay, so you are, sometimes you're able to close your eye on your own?
It's getting better.
Okay.
Let me make sure.
Okay. And we're just going over the end of the facial nerve. And we've done all the other points. This is not the only point that we do. And the next thing we're going to do is an upper cervical adjustment. And we'll show you that. And we do about a minute in each spot. So she's just at about a minute here. And I'd say by Monday, you should be about 70-75% better. Okay, and next week, the next 2 weeks, really we should have you at 100%. Okay, so all in all, this will be about a 4 to 6 week process to get through this. And we're done here. Okay, now I'll take your glasses. And I'm just gonna start you with some heat. okay? And put it around the neck just to loosen the muscles up, keep the muscles soft, and then we're gonna come back in and we're gonna adjust her, and we'll show you that in a minute. We wanna make sure there's not a lot of tension in the neck and that the cervical spine is in place, in its proper place. And that has not been the case for the last few weeks for her. So as we adjust the spine, manipulate the spine, we're able to take pressure off the nerves, relieve a lot of tension in the muscles across the neck and the shoulders. And have you had any headaches? No. Okay. So we're going to do a couple of corrective adjustments here to the neck. And you may hear a little cracking noise, as you probably know already. You've had your neck adjusted before. Just relax yourself here. Okay. And relax here. And then we do a specific adjustment for upper cervical work because of the Bell's palsy. So we're going to do something called a toggle recoil adjustment. And just relax yourself here. Okay, you're going to lay on your side, on this side, facing this way. And slide down for me. A little bit more, just a smidge. Okay. Right there is good. Okay. Okay. And you're just going to place your hand over here. And this is a really gentle adjustment. It's called a toggle recoil. And this is an adjustment specifically for the upper cervical spine and on your back. Please, yeah, on your back. Okay, now things feel great now. Do you have tension there?
No.
Here?
No.
All right, so if you have any questions about Bell's palsy or any kind of neuralgia, pinched nerve, neuralgias of any sort, feel free to comment below. We'd be happy to help you out and answer any questions you may have. Thanks, and make sure you thank Amina too. All right, this is part 2 of our Bell's palsy treatment video and cold laser treatment for Bell's palsy. So we're now, tomorrow will be 4 weeks exactly, right? So we're just at 4 weeks into the start of our treatment. And how are you doing so far?
It's getting better.
Okay.
Yeah.
What kind of improvement would you say you've seen so far as percentage-wise? 70, 80, 90% improvement?
Yeah, I'd say about 80% improved.
Okay, so obviously the face drooping, go ahead and smile. The face drooping is a lot better. The severe, intense pain that she had into the face, into the jaw, into the tooth has all cleared up. And now we're just dealing with the strength in the eye for her to be able to close her eye easily. And that's still a little difficult for you, correct?
Yeah, doesn't close all the way without me pushing it.
Okay, my guess is here in another week she should have that completely resolved just in time for Christmas. But we're finishing up. Again, we're 4 weeks into treatment. She's 80% better. And she'll get to that 100% by next week. So 5 weeks in, that's really good considering all the other types of treatments that are out there for Bell's palsy, which are none. There are really not a lot of treatments except for medication, which oftentimes does not work. This inhibits the nerves, the facial nerve in particular. So we're going to go back over those points again, and it's been on her right side. So we're going to focus the laser on the right side, and you're going to slide this up here, these glasses up, and just keep your eyes closed. Okay. So the facial nerve branches out in the face into a few different branches. We're going to focus on the branch that controls the eyelid. and also the facial nerve into the cheek. Because we've only got a couple more treatments left here for her before the holidays start. Then after this, we're gonna give her a chiropractic adjustment to alleviate any pressures on any nerves in the upper cervical region, and then we'll do some gentle traction with a Y strap. Okay, so we've just done laser along the facial nerves and many of the different branches that branch off from the facial nerve. In particular, the nerves that control the eyelid and raising and closing the eyelid, especially on the right side. So we just adjusted her cervical spine and found a few subluxations in the neck that were compressing some of the nerves. Her neck pain and headaches are gone. She doesn't have that at all. Everything is much better. Just that eyelid is the last touch. So we're just going to do a little traction. This is called a Y strap. Lift your head gently for me. And bring it back. This feels amazing. It's cervical traction or spinal decompression. This is really good for people with pinched or compressed nerves in the neck due to a disc herniation or a disc bulge. Just apply a gentle pulling pressure for about 45 seconds. How are you doing there? Okay. If you have any problems or pain, just raise your hand, okay? Do that for about 45 seconds. We're separating the spinal vertebra. And if there's a disc bulge in the spine, the disc acts like a vacuum, and that bulge can suck back up into the proper space where it belongs. So this can be really helpful for disc bulges to try to reverse them and prevent them from herniating. This also helps to remove pressure off nerves and stretch out the neck. And we do about 3 45-second pulls. And just depending on the size of the patient, depends on how much pressure I use to pull. That's pretty much it. Again, one more week and she's going to be completely symptom-free and completely through this Bell's palsy. So 5 weeks of treatment with cold laser therapy and chiropractic care, and that should clear up your case of Bell's palsy. Thanks.